Chronicles Fam Squad, welcome back to another vlog. Welcome to our old Gales Chronicles Fam Squad members, and welcome to our new Gales Chronicles Fam Squad members. And remember to like, share, subscribe, and comment. Comment so that we can have that conversation. So you can tell me what you like about the videos and what's happening in your neck of the woods in regards to the topics we discuss whenever I do a vlog, a sit-down vlog like this, right? And if you're new here, if this is your first time watching us, please catch up on previous videos so that you can get to know us and join our Gales Chronicles fam. Today, we will be discussing the healthcare system, comparing the healthcare system of Canada with the healthcare system in Jamaica. And this is going to be an interesting one. I know you're going to like it. So, the Jamaican and the Canadian healthcare system does have some similarities as well as differences. One of the major similarities is that, just like Jamaica, we have free healthcare. Yes, we have free healthcare system here in Canada. And if you're a resident of our province, each province has their own insurance plan. So for Ontario, it's called OHIP, OHIP, which is Ontario Health Insurance Plan. And that's for the residents who live in OHIP. Whatever provinces other individuals live in, they will have their health card for their province, such as British Columbia, Alberta, Quebec, wherever else they are, they will have their own insurance plan. What OHIP covers is hospital and doctor's visit. It covers hospital and doctor's visit. So even if it's a private doctor that you go to here in Canada, once you have your OHIP, you present that to them and you can get to see your doctor without being charged, right? If you don't have OHIP and you go to a private doctor, or even if you go to the hospital, it can cost you quite a bit of money. Like just seeing a doctor, just a regular checkup is 80 Canadian dollars. Depends where. My family doctor is 50, but to go to a walk-in clinic, it's 80. So that's going to the doctor without the OHIP card. And why I know these costs is because when we just came and I had to navigate the healthcare system as a newcomer here, I didn't have an OHIP card. So until you have your OHIP card, you have to be paying out of pocket, right? In Jamaica, healthcare is free in both the hospital and the government clinics. And the government clinics also have like dental and optician. They have different days for different specialties, and you can go in and you can get those services free in Jamaica, right? While here in Canada, dental is free for only children up to 18 years old and the elderly, so the pensioners. So that's what it covers. For optician, you have to have your health insurance for those. And dental, you have to have health insurance, whether you're with a company or you're with working in the government who subsidizes a healthcare plan for you, right? So it would be something similar to Sagicor What I have is Green Shields, and I have another one here, Sons. So Green Shields from my company, and Sons, can't remember. The one from my husband's company is another insurance. So it works out for us. In Jamaica, however, there are health cards that are given for specific reasons, just like we have in Jamaica the Jamaica Drug for the Elderly program, and we have the National Health Fund cards. Those cards are given to individuals with specific illnesses, and they subsidize the cost of medications for those individuals. Here in Canada, our healthcare system does not cover medications. You are on your own with medications unless you have personal insurance, personal health insurance. So you're on your own with medications. What I love about Jamaica is that having a family doctor, you can have several. I have a family doctor for the years I went to university in Mandeville. I have a set family doctor there, and for when we lived in Mandeville. I have a family doctor in Kingston. I have pediatrician for my son in Kingston. When we moved to Ocherius, I have, I think I have 3 family doctors. Yes, because my family doctor still sees everyone. My original family doctor has been seeing me since I was 2 years old. And my pediatrician in St. Anne was my son's pediatrician when we lived in Jamaica. So, you know, here in Canada, it's hard to get a family doctor. And when you get into a clinic, you just stick with it because it's hard to get into another clinic, right? So when I came here, I had to start searching for a family doctor. And it wasn't until during the pandemic that I was able to get a family doctor for my family. Yes. And how you get a family doctor? When you see them put up signs on their practices that we are now accepting new clients, that's when you rush in and you ensure that you register your family with them, and you pay for consultation visit so that they can take you on their practice. So that's how we got our family doctor here in Canada. And we have moved from where we used to live. So if I need to go to my family doctor, I have to make an appointment. And let me tell you, sometimes when I call to make an appointment, whether it's for myself, my husband, or my son, it's like weeks before you can get an appointment. He is that packed. So, yeah, be grateful for the family doctors you have in Jamaica, that you can access them easily. Be grateful. One of the things here, if you can't get to your family doctor, we have walk-in clinics, and those are accessible. Where I live in Brampton, we have, like, within walking distance, I have 4 walk-in clinics that I can go to in case of anything. And you just go with your OHIP card and they will see you. But always remember, whatever medications, you will have to pay for them, right? All right. In regards to hospitals here, just like back home, it's a long waiting time. It's a long waiting time when you get to a hospital here in Canada and in Jamaica. It's the same thing. And being the fact that I worked as a nurse in the hospital system back home and working now in management here in Canada, you see the differences. You see the differences. And let me tell you, it's no different from Jamaica. I think it's like, all right, the last hospital I worked at in Jamaica, the emergency room was like an emergency ward because the wards did not have enough beds. So you had to house individuals, patients, until the wards could accommodate them at the emergency room. While here in Canada, it's the same problem. We have what we call hallway nursing, where you have patients in the hallway of the outpatient area, patients on seats, patients sitting down in the hallway on the floor, waiting to be seen and treated, just like back home in Jamaica. Yes, we're in a first world country, but we are still having the same problems like we have in Jamaica in the hospital system here. Seeing a specialist back home in Jamaica is easy. Seeing a specialist back home in Jamaica is very easy. I can say I want to see a dermatologist, I want to see orthopedics, and I can go. Here in Canada, I'm going to give you an example. My son got injured while playing basketball, and he was having severe pain, and because he had that arm broken in Jamaica years ago, and it was swollen, and I mean really, really painful for him. And I went to the doctor, gave me something for it, said I should watch it, nothing was happening, and I decided, okay, I needed to see an orthopedic doctor to deal with it. Called the specialist. The lady told me that my appointment would be in 1 year and 3 months. 1 year and 3 months. And I was like not having it. I took my son to another doctor who sent us to get an x-ray done, and we had to wait a couple of days before they got back the results, and he said, it's not broken, it's just that there was some tissue damage and I should just let him rest it. I let his coach know at the time that he couldn't be practicing or anything like that until he was well enough. Had it in sling and bandage and the whole works. Yes. So be happy when you can get to see your specialist back home and get things done in time, right? I spoke to this on when I spoke about things that shocked me when I came to Canada. The fact that in Jamaica we have school nurses, and here we don't have no nurse in the school. So there's nobody to render first aid to your child when an injury happens at school. And I don't like that. There's not even nurses on the campuses of the universities or colleges here. They don't have those services. I went to university in Jamaica, and I remember boarding and being an asthmatic and getting sick. Both the nurse and the dean of the dorm took me to, did their best with me, and then took me to Mandeville Hospital for further treatment, right? So it's very, very important that we we appreciate the good things we have in Jamaica. So that's another difference between Jamaica and Canada. Getting certain meds in Jamaica is easier than here in Canada. For example, if I want iron tablets and a tonic, or I need to get worm medicine for my child, I have to get a prescription from a doctor here. While in Jamaica, I can just go into my pharmacy and get those medications over the counter. The same for certain medications in Jamaica, I would need a prescription. Like for Allegra and Claritine in Jamaica, I need a prescription. Here in Canada, you can just get those over the counter without any prescription, right? Finally, I'll talk about the emergency response. The emergency response in Jamaica, as we know, is very slow compared to the emergency response here in Canada. The moment something happens and you call the ambulance, fire brigade, police, everybody coming, right? While in Jamaica, it takes a while for an ambulance to get to you when you have an emergency. So while there are pros here and pros home, there are cons here and cons home. I hope you enjoyed this vlog today, and I look forward to the other vlogs with you. So remember to like, share, subscribe, comment, tell a friend to tell a friend, and I will see you on the next vlog. Thank you. Bye-bye.